let me ask you a question. How is effectiveness measured for this? Because one of the things down the road, and we're going to talk about, is long-term coverage, right? Because there's like, yeah, even if you had the vaccine, then you still need to wear masks. And at the end, the antibodies cover. And if you got sick, you still need it. So how are they really measuring effectiveness on this? And is that an adequate measure at this moment in time?
There are a couple of endpoints, and the different companies are using slightly different endpoints here to measure this. And backing up a little bit, the fact that there was so much COVID circulating around the world, particularly in the areas where these clinical trials were being done, is also what helped accelerate the results. If you are giving a vaccine for something that's relatively rare, you have to wait a very long time to see whether fewer people who got the placebo got sick than people who got the actual vaccine. So the main endpoint for most of these has been, for effectiveness, is did they get sick? Did they get COVID?
The two groups, how many people got sick? They didn't intentionally expose them to it. They just let them back to their life.
Right. They didn't know, it's double blind.
Right.
Some got a placebo, some got the actual active vaccine. And then you turn them loose. You say, I mean, obviously, if you're going to wear a mask, whatever it is that you normally do. And then they compare how many people got sick in the vaccine group versus the placebo group. Now, secondarily, for example, Johnson & Johnson, the Janssen vaccine from J&J, they've also been looking at effectiveness in terms of reducing serious disease, meaning hospitalization and death.
Wouldn't they all do the same thing if your immune system is heightened sensitivity to it?
You would think, but not necessarily. Not necessarily until you can actually prove that. You can't actually say that. For example, also the J&J vaccine says that it is effective at reducing transmission. So just because you've been vaccinated and you don't end up in the hospital or dying, doesn't necessarily mean that you can't be harboring or be a reservoir of virus. It may not be making you sick, but all of us actually carry a lot of different viruses and bacteria, particularly in our nasal passages, that we've come to a truce with. You know, we have a ceasefire.
Right.
But certain things might activate it in a way that could still make us sick, or we could transmit it. So that's what these vaccines now are trying to demonstrate, that they actually prevent the transmission.